Hello, everybody. I am Dr. Audrey Wells, and today I want to talk to you about obstructive sleep apnea, and more specifically, what is on the treatment menu for OSA. I am the Chief Medical Officer at sleep.com, that's SLIIP, and also relevant to this conversation, I am board certified in sleep medicine and obesity medicine. I am a women's health advocate, and I'm certified in menopause care by the Menopause Society. So let's get going. Just first a disclaimer, the information I'm presenting today is meant to be educational and supportive. It does not create a doctor-patient relationship between you and me, but I am bringing all of my medical advice to the conversation so that you have some things to consider. First off, I want to tell you that sleep apnea is sometimes discounted. It's sometimes kind of pushed off on the priority list, but I like to highlight that sleep apnea is actually a breathing disorder. It occurs at night under the cloak of darkness, but make no mistake that sleep apnea results in drops in your blood oxygen and significant sleep disruption in the form of awakenings that you may not even recognize. So it causes significant strain on your physiology and even your mental health. When you think of sleep apnea being untreated or undertreated, I want you to understand that untreated breathing disorders and untreated sleep disorders affect your entire body. And when I talk to people about this, I focus on neurological health, cardiovascular health, metabolic health, and mental health especially. So if this is something that concerns you, you are in the right place today so you can understand how to get better. Recognize, please, that men and women have different symptoms when it comes to sleep apnea diagnosis. In history, men have a loud snoring sort of profile. They have those witnessed apneic events that cause their bed partners to be worried for them, and oftentimes they have sleepiness during the day. Women can have sleep apnea with much more subtle symptoms. They may snore or not. They may have witnessed apneic events or stopping breathing events or not. Oftentimes, their symptoms are very nonspecific and difficult to pinpoint, which is one reason why women can be delayed to diagnosis. And I want to highlight that because for all the women watching, you should really take it seriously. Even if you don't think you have sleep apnea, it's worthwhile to get tested. I want to review some non-surgical treatment options for sleep apnea. And then later, I'm going to talk about some surgical approaches. Now, among the non-surgical treatments, you have PAP therapy. This is often CPAP or AutoPAP. You have oral appliance therapy. Weight loss has come up as a very viable treatment for sleep apnea. And there are some other non-surgical treatments that I'm listing here that I won't have time to talk about today. So I am going to focus on these first three. Now, a lot of people have heard about PAP therapy, and again, this is mostly CPAP, or continuous positive airway pressure, or AutoPAP, automatically adjusting positive airway pressure. And this is considered the gold standard treatment for obstructive sleep apnea. But why? Why is this the gold standard? Well, the first reason is that it creates a multi-level air stent in the upper airway, which is surrounded by soft tissue and very vulnerable to collapse during sleep. So that multi-level air stent is an advantage that CPAP has. The pressure is customized for each individual. So sometimes a person would have an in-lab sleep test to raise or lower that pressure so it's just right. Other people have AutoPAP, which is the automatically adjusting pressure setting that goes up when you need more airway support and then down when you don't need it. So that pressure customization sets it apart from other therapies. Thirdly, It is known that CPAP is the most reliable treatment for obstructive sleep apnea, meaning I can bring 99 people into the sleep lab and their sleep apnea would be treated with CPAP alone. The problem is adherence and using it with comfort. I do say that it's non-invasive. This is the fourth feature that makes it the gold standard. But a lot of people truly have difficulty using CPAP because of discomfort with the air pressure or discomfort from the mask. And this is part of why I want to highlight other things on the treatment menu today. If you are a CPAP or AutoPAP user, please realize that the treatment is only effective when you're using it, and your goal should be using it throughout the entire night or the entire sleep period so that your sleep apnea is treated all the time. When you are not using PAP therapy, your sleep apnea is not treated. Now, I take it upon myself to use all the different types of therapies. So I've tried all the CPAP masks, I've tried the oral appliance, I've tried it just about everything. I have not gone so far as to have some of the surgeries. But listen, I get it. I get it why the mask is uncomfortable and you don't want to do it. So I want to talk about some common concerns with CPAP. CPAP can be a reason why people don't get tested. If you feel like CPAP is your only choice and you don't want to use it, you may think, I'm not even going to get tested. This is a problem because you're essentially putting your head in the sand for a medical condition that is very treatable. So let's talk about another situation. What if you're new to CPAP and you've been struggling? You may be wondering, what is normal? Is this okay? How long do I have to go through this acclimation period? And then there's the CPAP challenge. These are folks who've been using CPAP for quite a while, but they say, I don't really like it. Even though I use it, it's really difficult for me. And these are kind of the people who are white knuckling it to get to that 4-hour mark or begrudgingly putting their mask on at bedtime. With the CPAP reluctant, oftentimes what I hear is, I don't want the mask. And you're kind of putting your hand over your face, indicating a full face mask. It is my stance that people need to know about all the different types of CPAP masks, and the full face mask is only one flavor. In fact, people who use nasal masks, either masks that go up to the base of the nose or over the nose like a triangle shape, actually have an easier time with CPAP. But that type of mask, whether it's up to the nose or over the nose, does require you to breathe through your nose throughout the night. And that is important because people who do nose breathing have better sleep anyway. Listen, we all had this experience with masks and getting used to something on our face a few years ago. And I want to tell you that even when you don't think you can, with a little practice, you can get through that period. Sometimes CPAP is equated to a scuba mask, which you kind of use because it creates this functionality with breathing while you're trying to be in the water. And the same idea applies to your sleep. And I like to point out, too, that there are some occupations where using a mask for multiple hours at a time is an expectation and can be made to be tolerable. In fact, there are children that tolerate CPAP. And if you're an adult who uses CPAP, I think it's kind of a good perspective to realize that if young children can acclimate to such a therapy, this might be a possibility for you too. So for the CPAP reluctant, I tell them, please recognize that you may have a breathing disorder that needs to be tested and that needs to be treated. You got this. I'm going to show you some alternatives today. For the CPAP newbie, sometimes that question about what is normal, how much should I put up with, how do I know this treatment is for me, comes down to expectations. So you kind of have this plan that, okay, I've got sleep apnea, there's something to work on, but the reality is the road gets much more bumpy than you were expecting, and some people actually have bed dread as a result of starting a new treatment like CPAP. Sometimes in my teachings and talks, I talk about all the different masks contributing to the angst that goes into CPAP acclimation. Some people actually have a mask graveyard, kind of all the different things that they've tried, and that's when they start to wonder, am I really cut out for this? What I want to say for those who are kind of on the fence at this point is that daytime practice counts. It counts towards your adherence or compliance score, and it counts toward teaching your brain that this is what I do now to treat my breathing disorder. So practicing during the daytime really takes the pressure off of you to sleep. So some of that performance anxiety can get in the way of acclimation at night. When you start a new treatment like this, it can sometimes be a mind sort of position that you're going to have grit, you're going to employ your sense of humor, you're going to experiment with different things, because this period of acclimation is a necessary part of the therapy. You want to increase your self-care activities. You want to get support from your bed partner or someone else who uses CPAP. All of this goes into increasing your chances of success. For those who are in the CPAP newbie phase, I like to say consistency is really key. Use the treatment as much as you can, night after night, and commit to your sleep health. You really want to get to a place where you have made peace with the idea that you're going to use CPAP, and this can go a long way to helping you get to sleep and stay asleep. However, there are still the CPAP challenge, those who say, I use it, but I don't like it. And if you start to feel a lot of different emotions related to the CPAP therapy, and you're at the point where you're just ready to kick it to the curb, then you'll be interested in the things that I'm going to talk about next. So that emotional roller coaster with your CPAP, despite your best efforts at acclimation, your best efforts at optimizing the comfort, the fit, the pressure, and all of that, if it's not working for you, then it may be time to explore PAP alternatives. If you feel like CPAP is not for you, it can be really helpful to define what the problem is. Is it the mask? Is it the pressure? Is it the fact that you've brought a medical machine home to sit on your bedside table? What is causing you the issue? And this may help to direct your next steps. You have options, okay? CPAP is not for everyone. And I think before you throw in the towel and decide that you're not going to get treated at all, there are some steps that you can go through to make sure you've given everything a try. I also want to open up the idea that sometimes treatment layering is appropriate. So you can think about PAP therapy with other treatments or alternating treatments. You can also think about PAP alternatives, as I mentioned. What are some other non-surgical treatments available? Well, oral appliance therapy is a treatment that is a dental sort of sleep apnea device, and it's separate from CPAP, although the two can be used together. Let me tell you what it is. Oral appliance therapy can also be known as mandibular advancement device, or MAD, and what it is a custom-made oral appliance that fits on your upper teeth and your lower teeth. The two pieces engage to bring your jaw forward during sleep so that you're pulling your tongue out of the soft tissue airway. And that is going to give more space for breathing. This requires a sleep apnea diagnosis to get any insurance coverage at all. And for some people, that insurance coverage is simply not there. And I want to say it's not dental coverage that you're looking for, it's actually medical coverage for the oral appliance therapy, but the device is going to be made from the dentist's office. So the insurance billing is variable. If you go with an out-of-pocket payment plan, you're going to be looking at costs in the thousands of dollars. This is worth it to get healthy sleep, but I'm going to give you some tips here. You really want a dentist who is knowledgeable and experienced in making such devices, because they are going to help walk you through something that is going to be as effective as possible and avoid creating other problems like tooth movement or stress at your jaw joint here. You do not want to create other problems as a result of treating your sleep apnea. If you want to go this direction, I highly recommend going to this website on the slide here. It's AADSM, American Academy of Dental Sleep Medicine.org, to find a provider in your area. Now, a pro tip is that the responsible dentist who is going to make an oral appliance for you should also make a morning aligner device that you will pop in after you take your oral appliance out at night. So you pop in the device in the morning, and that will help shift your teeth back into their baseline position, because you do get some tooth movement with this therapy. It's also important to note that you must have a follow-up sleep study after you've acclimated to the oral appliance to confirm it's working, because it doesn't work for 100% of the people. In general, I tell people that this works about 70% of the time. And there's some nuance to, who's a better candidate or not. But the dentist you see who is experienced in making such treatments will be able to walk you through that. Let's talk about weight loss as a non-surgical treatment for obstructive sleep apnea. First off, there is a myth out there that only overweight people have sleep apnea. This is simply not true. The fact is, sleep apnea is the result of multiple contributing factors aside from weight. And we know this because about 25% of people with sleep apnea actually have a normal body mass index. Let's talk about some of the other contributors that would increase a person's risk for sleep apnea. So yes, body fat amount and the pattern of fat distribution does increase risk for sleep apnea, especially if you carry weight in your belly, weight in your neck area, or in your chin. Those are indicators that you have some deposition of fat in the soft tissue airway that's going to make it more collapsible during sleep. But look at that second risk factor. Age. Every year that passes by, we experience tissue laxity. Ask me how I know, because I've got all these wrinkles that I didn't have before. And that tissue laxity goes into your upper airway as well. So age is also a risk factor for sleep apnea, as is sex, particularly male sex, and hormones. So this affects postmenopausal women. These are the top 3 contributors to sleep apnea risk. Other contributors include the anatomy of your airway or your face, the neurorespiratory control mechanisms that come from your brain are inherited from your parents, and your degree of airway tissue collapsibility. Finally, medical conditions can increase risk for sleep apnea. Things like high blood pressure, diabetes, stroke. All of these things can affect your neurorespiratory control mechanisms, your vasculature, and even the efficiency of your breathing. Substances and medications can affect your risk for sleep apnea, and sleep factors like REM sleep or non-REM sleep, sleeping on your side versus your back, those can also play a role. The truth is, obesity is a major modifiable risk factor for sleep apnea. So losing weight can improve sleep apnea and sometimes result in sleep apnea remission, whereas untreated sleep apnea actually makes it harder to lose weight and maintain that weight loss. So when I speak about treating sleep apnea with medication for obesity, you're really killing two birds with one stone, and it makes a lot of sense to treat both conditions. I ask people, what has your experience with weight loss been? Because if you've tried hard to lose weight, it may be time to consider medication. And when you talk to your primary care provider or someone else who has an interest in your health, who might be a prescriber for this medication, you really want to make sure that weight stigma isn't entering into the conversation, because a lot of people still think that sleep apnea is only due to being overweight. But I want you to have this new perspective that could be a significant contributor, but it's not the only thing. You still need a healthy diet. You still need good exercise to have responsible and permanent weight loss. But now this is a very viable option to treat both obesity and sleep apnea. Let's talk numbers. So if you have a highly effective anti-obesity medication like tirzepatide, there's about a 50-50 chance that weight loss is going to result in sleep apnea remission. That word remission is something that I want to point out because a lot of people ask me about sleep apnea cure. But remember, the second risk factor for sleep apnea is age. So even if your sleep apnea goes away with weight loss, age may make it creep back into the equation. If you take a weight loss medication like tirzepatide, for example, which is indicated for sleep apnea treatment, there is actually a very high chance that your sleep apnea severity will improve. And this is relevant because it may open up other treatment choices for you, treatments other than CPAP. So we're going to talk about some of those. When you consider weight loss as a sleep apnea treatment, just realize that those anti-obesity medications sit on the pillars of nutrition, exercise, and behavioral change, and all of those are grounded on a foundation of healthy sleep. This is the best approach when you're losing weight, when your lifestyle is supportive, and you're wanting to preserve muscle tissue. Healthy sleep, in other words, treating your sleep apnea fully, makes weight loss easier and more permanent, and weight loss may put your sleep apnea in remission or open up alternative treatments, but if your weight comes back, more than likely your sleep apnea will come back. Let's talk about surgeries. Briefly, I'll describe what had been the most common surgery for sleep apnea, the uvulopalatal pharyngoplasty, or UPPP. Then there's the hypoglossal nerve stimulation surgeries, including Inspire and others. Nasal procedures I'll touch on briefly, as well as bariatric surgery. With the UPPP, what you're looking at is a surgical debulking of the airway. So that means you're going to an ENT surgeon who's going to cut tissue from the back of your throat, and this often involves repositioning muscles in your airway to stent up that tissue and create more space for breathing. Historically, a procedure like this is associated with about a 40% improvement or remission in sleep apnea, and for some people that's meaningful. For others, they expect more. For every 10 ENT docs who do the uvulopalatal pharyngoplasty, you're actually going to get about 10 different techniques. So if you go this route, it's really important to talk a lot to the ENT doctor that you're considering to know what their rate of success has been and how they screen for candidates. Let's talk about the Inspire device and the Genio device. These are hypoglossal nerve stimulation implants. I'm going to focus, I'm going to show you some pictures specifically about the Inspire device, which has been around longer than Genio, but stay with me because the Genio has a little bit of an advantage that I'll describe in a second. So the Inspire device is an implantable battery that goes in the upper right chest, and that's so your left chest is reserved for a pacemaker if you need it. This piece is implanted just above the ribs, and then there's an electrode that's snaked up into the base of the tongue. There are some eligibility criteria for having such a device implanted, and it's very important that you read through this if you are considering a hypoglossal nerve stimulator as a treatment for your sleep apnea. There tends to be a long runway toward getting evaluated to confirm your candidacy for a device like Inspire, and the end time, which is when the device is activated to finally get treatment. So this is coming as a surprise to some people who are interested in Inspire or Genio, and I just want you to be aware that it does typically involve a renewed sleep study, collaboration with your sleep doctor and an ENT doctor, and finally, several months later, you're going to turn on the device and use it at night. There are some post-op care measures. Some people ask me about the scarring associated with the device, and I'm showing a couple of pictures here. This is something that also varies with different surgeons, so asking them to see pictures and to get their own experience can be very important to your situation. I mentioned that the Genio from Nyxoah has a little bit of a different mechanism. It's actually a bilateral nerve stimulation, whereas the Inspire only stimulates one side. And it is an external device that you apply at night that activates the internal piece, which just sits up in the tongue. So again, you have to be able to meet all of the criteria for eligibility. Consider the time it's going to take and the number of appointments you're going to have. This may influence how you approach the insurance payment situation. This is effective for some, but not all, and it does not make all of your sleep problems go away. In fact, I do have some hesitancy when I recommend hypoglossal nerve stimulation to someone who has comorbid insomnia. Insomnia is persistent with these types of devices. Nasal procedures can be done to improve sleep apnea, but they're more appropriate for increasing therapy options. What do I mean? If you have a very deviated nasal septum, if you have lots of swollen tissue in your nose, getting a surgical intervention to open up that nasal cavity doesn't typically cure sleep apnea or put it into remission, but it does enhance treatment options for something that was otherwise uncomfortable, such as CPAP. Finally, with bariatric surgery, you're going to have the same sort of idea as with medical weight loss with a medication like tirzepatide or other. The bariatric surgery causes weight loss, which then reduces sleep apnea severity, or in some cases causes remission, again, about 50% of the time if you're losing 20% of your body weight or more. There are some emerging therapies coming up. For example, sleep apnea medication, which is currently named AD109, is a combination medication that increases the stability of the upper airway muscle tone during sleep. That is currently in clinical trials, and I have my finger on the pulse of when that's going to get released. There's some new advances in GLP-1 medication, in particular oral medication, some dual and triple agonists, and hopefully some increased coverage options for those medications as it applies to obesity or sleep apnea. Finally, there are some non-invasive neuromodulation devices in the pipeline, and I hope that those are out soon. We're looking at probably a little beyond 2026, but that's a very exciting area of development. When it comes to the treatment menu, I want you to increase your mindset about the idea of monotherapy versus combination therapy. So I've listed the categories here, with PAP therapy being the gold standard, but the truth is, as we move into an era of personalized medicine and medical therapies, you really want to look at other treatments in the concept of layering to make something work for you. The bottom line is that your sleep apnea deserves treatment. It deserves treatment throughout the night. And if you have REM predominant sleep apnea and you've been told that your sleep apnea is mild, just recognize that you have a breathing disorder night after night, decade after decade, and that does impact your health. This treatment layering idea is something that you can advocate for when you talk to your sleep medicine physician or your primary care physician. And treatments for sleep apnea are only effective if they're used well or used throughout the night. Finally, for any treatment that you elect to have, retesting with that treatment in place is really important to confirm that it works. Because if you're going to go to the trouble of using such a treatment, you want to confirm that it is actually effective for you. Some people ask me if their consumer sleep tracker is enough to get that confirmation. I'm sorry to say at this point it is not. So see your sleep doctor in order to get the test that's needed. In conclusion, I want to point out that healthy sleep is a fundamental biological need. It is critical to your mental health and physiological health that you can enjoy healthy sleep so that you can have better daytime energy, clearer thinking, better mood, reduced appetite, better weight management, reduced risk for things like stroke, heart attack, diabetes, dementia. All of these things are made worse if your sleep apnea is not treated. I'm Dr. Audrey Wells, and I am an advocate for sleep health. If you want to find me, you can go to sleep.com. That's SLIIP. I'd be happy to see you in our clinic and help you get on the path to better sleep for good.
If you found today's Health Talk valuable, we invite you to help us continue providing trusted, science-based education about obesity and health. Visit obesityaction.org/donate to contribute today. Your generosity fuels our mission. Thank you for making a difference.